I'm going to go through a couple of slides, so just to give you a little bit of background before I do a demo of how we're using the IBM Watson cognitive technology at the point of care today in helping MS patients connect with their providers who now have access to evidence-based medicine at the point of care. So you heard a lot about the challenges today of how you deliver solutions to address the needs of clinicians, but also providing a collaborative consultation opportunity when they're with their patients. So that's, inadvertently ended up what we built. That wasn't our goal. Our goal was to just solve a simple problem. How could we help patients who are tracking their health using digital tools today connect and share that information back with their providers? So we, just to give you a quick background, we sort of had an unfair advantage. Our previous company was acquired by a US-based company called Everyday Health. That company was MedPage Today. So at MedPage Today, we help solve a problem for clinicians who were faced with helping patients coming into the doctor's office, asking them questions about articles or news reports they had seen in the common press. The challenge was the clinicians, most of the time, hadn't seen that, and they didn't know how to respond. They didn't have the right information. So we built a tool to help aggregate consumer-facing health information, make it actionable for providers, and give them CME credits so they could learn and be interactive with their patients when they had that opportunity. So we discovered something. We figured out how to engage clinicians, which was to give them something for their time. So after the acquisition of MedPage Today, we saw a similar pattern emerging. We were fortunate enough to continue to work closely with clinicians throughout our history. And in that process of figuring out what to do next, we saw an increased spike in our web content coming specifically from iPads. In the US, physicians were some of the early adopters. I think the stats are something today, around 80% of US doctors use iPads specifically. And so we converted all of our web-based content into disease-specific mobile apps. We now have 22 different apps that clinicians can download for free. And those apps are able to provide them a point-of-care resource that gives them peer-reviewed content that's CME accredited. So within this platform, when this challenge came up, how do we connect patients who want to be able to share their information with providers? Because we had this resource in place, clinicians came back to us and said, could we see it within the tool we're already using? So that's what we built. We built a HIPAA-compliant data store within these reference apps now that lets clinicians receive patient-generated data when requested at the point of care. So it helps us complete this cycle you see on the screen. We help connect patients with their data, help doctors discover insights using evidence-based information, now through the power of IBM Watson, to deliver better outcomes and improve care for patients and health systems. So this is the platform. So the iPad represents the clinician experience, and the iPhone, which could be any mobile device here, represents the patient side. And this is a prescribable application coming from our platform or patient discovered independently, which can recruit doctors to connect with them. And all created through that dynamic sync in the middle that provides easy, efficient transfer information. So this is one example of how we're using this tool for multiple sclerosis. We partnered with the Multiple Sclerosis Association of America, who have 40,000 members, of which a high percentage of them were already doing some level of tracking. The challenge they kept hearing was patients didn't have a way of getting this information to their provider besides holding the device up to their face when they went to go see them. So we built a partnership that allowed us to bring them onto our platform. So now those patients are able to securely share their information with their providers and give tools now for the providers to do something with that information. So in this case, it's a place for them to review the information, share relevant patient education material, and also leverage the Watson tool to help answer questions. And the data coming back to the clinicians is presented in a form that's efficient and easy for them to consume. So 3 or 2 months of data coming back from patients is created into charts and forms. And where we're moving with this is phase 1, is to take that insight, build on the data model that we're now getting from live patients generating real-world outcomes from 600 endpoints from the patient app. So you can now create a model around which of these data sets can you do something with. So to give you a clue, you're now able to give providers, how do I compare this patient that's in front of me to the multitude of patients that now I can aggregate data from and give them real-world evidence combined with evidence-based journals to move the way, as Seth mentioned a little while ago, real-world outcomes back to the provider. All of that now based in a tool that has ongoing existing resources. So doctors are already used to reading journals and looking up information. We just make that easier for them. And the way the information is put together is key, and this is what allowed us to leverage the Watson technology. So Watson needs really, in order to function, not only content, but training to help it understand the connections that it's making are true and valid. So this is our content creation process. Before the addition of the Watson tool, we would stop right here. Our medical experts and our clinical team create the content, goes through a peer-reviewed blind review process, and then it would go into our content platform. Now, we take that content, put it into the IBM Cognitive Engine, and curate and train that with 1,500 questions, and then maintain that on an ongoing corpus, so that there's no old information, it's always refreshed. So what that gives us now is a place for us to be able to deliver an experience that leverages the power of Watson, which I can talk to more in details later, but essentially consumes and creates insights and can deliver those insights within 3 seconds. So we do that, this is the way we leverage that. So we provide our content, leverage the Watson tool, so now when a doctor has a question, they don't have to worry that they didn't read that medical journal. Because we're starting from a curated, peer-reviewed, CME certified content set, the goal is to be able to help them find the answer faster than having to go through hundreds of search results. So they're able to ask a question, use that information when they're with their patients. More importantly, because we're able to store that question, they can come back later and pull it up and click on the Learn More button here and dig through a formal CME module and get credit for it. So let me show you how that works. So you should see on the iPad up there, so this represents one of the mobile apps that I referred to. So we have multiple apps already created. So these are all free for clinicians to use today, as well as for patients. So I'm going to walk you through the scenario of multiple sclerosis. So if I'm a neurologist managing an MS patient today, I'm used to patients walking in the door with stacks of paper, Excel spreadsheets, USB sticks, trying to show me the information that they're tracking related to pain, fatigue, symptoms that are key to help me manage that patient. So if I'm not able to go through that with them, I can now do this. Michael, I'm going to use an example. So I can say, Michael, thanks for coming in today. Sorry we didn't have a chance to go through your notes, but the next time I see you, I'm going to send you an app. So I click on Connect with Patients up there, and I'm now able to prescribe a mobile app that Michael would be able to receive and download and use it at home to create those endpoints. So now fast forward 2 or 3 months, Michael's back with me, and rather than having to rely on his memory and to conserve my time, I would be able to direct Michael to say, as I showed you before, use that sync button to say, Michael, show me what's been going on. So now I would tap on the patient records icon, and now I would see Michael's name pop up in my patient list and very quickly get a complete image of what happened in terms of the data that he was generating. So now this could be shown to me in a dashboard that I can quickly scroll through, medication data, quality of life issues, and even biometric data if you choose to connect any biometric devices. Now the reason this is important in the US is this now becomes a clearinghouse for me to validate patient-generated data. Any of these data sets that I want to track, I'm able to tag and add back up to the EMR and store it as a record for myself. Or if I have identified gaps in knowledge that Michael may have, I click on patient education and deliver targeted patient education material back to him directly to his app, not to a patient portal or him to receive an email, which then he has to follow through on. So I can send that through. Now, based on the information I received, if I have a question, I open my Watson tool, ask a full-length natural language question, and get a targeted answer back. So Watson curates information and gives you 4 answers, not 100 search results. So I can read that very quickly, use what I need, and take care of my patient. So now when I'm home, I realize, you know what, I had a question today. I wish I knew about that. So I can load up the question. Rather than having to remember, I can go to Learn More, and now this will take me and authenticate that to the place in the app where I can now participate in a long-form CME module that includes podcasts and videos and earn credit for learning from my patient. Thank you.